Hello friends. When the Creator made a man and gifted him a sex organ, what exactly did he have in his mind? Was it only for procreation, or was it also meant to be for fun? If you answer this question to yourself, then you end up getting several answers. Now, you must be wondering what this lion is doing here. Let us get some platform before we go any further. In some of the animals who, in fact, came before us on this universe, the ejaculatory time is even less than 10 seconds. Imagine you are passing through a jungle and see a lion, the king of the jungle. At around the same time, the lion sees a lioness that seems to be in a wild mood. He wouldn't have to think much about whom to give a preference. Even before you could blink twice, he would have charged towards the lioness, deposited his quota in the receptacle in 10 seconds, and having fully satisfied with his decision, would then charge towards you with the intention to have his delicious meal. But this example is not enough to give you an idea that the sex is only meant to be for procreation, for the lioness is known to have sex 20 times a day with different partners. Now, that should tell you that the sex is surely not meant only for procreation. I am Dr. Nandkishore and I am a family physician as well as a practicing clinical sexologist. Today, we will learn about the common sexual dysfunctions, and we will start with men. Erectile dysfunction. What is erectile dysfunction? Inability of the man to attain and then sustain the penile erection sufficient enough to achieve satisfactory sexual intercourse. It's a precise term for importance, a workable definition for a treating physician to decide whether a person qualifies for a working diagnosis is persistent inability for at least 3 months to attain or maintain an erection sufficient for satisfactory performance. In humans, procreation is taken as a coincidence if not an accident. The main purpose is recreation. Erectile dysfunction has its special place in clinical practice. Unfortunately, it's not a part of medical curriculum. At least it wasn't when I was a student. There is no way to know the prevalence of erectile dysfunction, for it still being a stigma, a social stigma. People do not come forward with the complaint. In my private practice, I see 2 to 3 cases every day. So if I see 10 male patients per day, the incidence should be at least 30% in general population. Incidentally, even those 3 patients who come to a clinic generally have some different problems. They just mention erectile dysfunction as a passing reference in a course of medical examination and try to portray it as just another symptom, though that's a leading concern on the agenda. Remember, earlier it starts and left untreated, more serious it becomes as you age. Erectile dysfunction is very common in either young population or those who are more than 60 years of age. Age-related erectile dysfunction is easier to explain. By the time men reach that stage, most of them have either diabetes or hypertension or metabolic syndrome or some kind of a debilitating disorder, which basically gives them a platform for erectile dysfunction. The most common reason in teenagers is the pornographic material that is available on the digital media at the click of a button. In most of these instances, the sex is displayed in the most exotic possible way, so the teenagers grow up with weird ideas about sex, and when they get to experience their first encounter with sex, they learn it a hard way that it's nowhere close to whatever is depicted on the tube. And what's the natural outcome? Abysmal failure. This failure haunts them in future whenever they have their sexual encounters. This forms a chain of failures from which it's very difficult to emerge victorious. Longer the better, sturdier the better, longer lasting the better. These are the ideas they grow up with. Ironically, this is the race where no man wants to come first. The person who always had strived his hardest to touch the final line first wants to do the exact opposite when it comes to sex, but his brains aren't conditioned for the situation, and then performance anxiety takes over. This is psychogenic erectile dysfunction. Other causes for psychogenic erectile dysfunction are relationship conflicts, sexual inhibitions, sexual abuse as a child, sexual preference conflicts, fear for pregnancy, and fear for sexually transmitted diseases. This is a cross section of penis. We are not going into the details of penile anatomy, physiology, blood supply, or nerve supply here. There are numerous sites where you can get those details. Here we are just trying to find out the practical aspects of ED. There is an interesting story about what must be going on in the mind of the creator when he created penis. First he wanted to make it only for the sake of procreation. Then he changed his mind. Why not to create a level playing field where Adam can have a little fun? Then the creator considered several choices. First he thought of making a bony penis, but then it would constantly be in an erectile phase. No way. Men would move in trousers with 3 legs. And then there was no way a woman could find out whether the man was excited after seeing her. The second choice was to make it out of skeletal muscles. But the skeletal muscles would again require the help of bone to support it somewhere in the middle. And skeletal muscles mean voluntary control. Men would move around the streets, flashing their erect organs all the time. The creator must have thought it a vulgar concept. No wonder the idea was dropped. And then he came out with this gem of a creation. There was no way this could have been any better. He created a special tissue called as corpus spongiosum and corpus cavernosum. Once a man is excited, a little blood enters in corpus spongiosum and remainder engorges corpus cavernosum, increasing both the length and the width of a penis. The function of the corpus spongiosum is to prevent compression of the urethra during erection. And here is something really interesting. During physical activity, the blood supply to heart increases 5 times its normal, but during sexual stimulation, the blood supply to the penis is increased to hopping 100 times its normal. What an idea! And it has been given an autonomous control. No one can voluntarily erect the penis at any given time. It requires certain prerequisites. And all these prerequisites go in for a toss in psychogenic erectile dysfunction. The causes for organic erectile dysfunction could be vascular, pre-existing cardiovascular disease, atherosclerosis, hyperlipidemia, hypertension, diabetes, and smoking. One very important point to remember is erectile dysfunction at a younger age could be a starting point for your cardiovascular event in the future, because if atherosclerosis can start in penile arteries, it can always start in your coronaries. Diabetes by far remains the most important organic cause for erectile dysfunction. Never to forget the fact that diabetes is basically a disease of nerves and blood vessels. The causes could be anatomical, like penile fibrosis, Peyronie's disease, or micropenis, or they could be hormonal, like central hypogonadism, thyroid disease, Cushing's syndrome, hyperprolactinemia, metabolic syndrome, and obesity. The causes for erectile dysfunction could be neurological, either central or peripheral. Central causes being traumatic brain injury, Parkinson's disease, multiple sclerosis, brain tumors, spinal cord injury. The peripheral neurological causes could be peripheral neuropathy and alcoholism. There are certain drugs which cause erectile dysfunction. Beta blockers, commonly prescribed for hypertension, migraine, certain psychiatric disorders, can cause erectile dysfunction. There are LHRH analogs. These are luteinizing hormone releasing factors agonists. There are some antidepressants, some recreational drugs like MDMA, LSD, oxycodone, amphetamine. These drugs can cause erectile dysfunction. Psychological factors usually coexist with organic ones. Even a bare minimal organic derangement causes performance anxiety. What a physician needs is to get answers to three basic questions. 1. Whether the disorder is of sufficient duration to warrant intervention. 2. Whether ED is the primary complaint or associated with other sexual dysfunction like premature ejaculation or low desire. 3. Is the problem secondary to medication use, a hormonal imbalance, a neurovascular disorder like diabetes, hypertension, metabolic syndrome, obesity, or is it psychogenic? Now that you know the type of erectile dysfunction, what next? If it is organic, treat the basic cause. If it is psychogenic, he will require psychological counseling. No easy answers, but it's treatable. And of course, with the advent of PDE5 inhibitors, everything looked simple. And believe me, if you do not have any contraindications to these drugs, then this is the best thing to have happened to all those millions of sufferers of ED. As the definition of ED suggests, in fact, the second half effect, inability to maintain the erection, it also entails premature ejaculation. In fact, PME is a part of ED, but it's generally treated as a separate entity. About investigations, diagnosis, and treatment of erectile dysfunction, we will learn it in my next video. Do not forget to watch it. If you are the one who is suffering from ED, merely watching the video can change your sexual life. If you like the video, give me a thumbs up and share it. If you haven't subscribed to my channel it.It, please do it to keep yourself abreast with the medical science that is so close to your life. Thank you.